Today I'm going to talk about the documentary Fed Up and also the rise of GLP-1 medications like Wegovy and Ozempic. I'll go over what the documentary was mainly trying to say and why these medications have become so popular, some pros and cons, and how this all connects to healthcare and dental hygiene. So first, Fed Up focuses on the obesity problem in America and argues that it's not just about people being lazy and not exercising. The documentary really emphasizes how processed foods and added sugars are everywhere, even in foods that are advertised as healthy. It talks a lot about how companies market sugary foods to kids and adults and how confusing nutrition labels can be. One thing that stood out to me was how much sugar people can consume without even knowing it. Foods like yogurt, cereal, granola bars, sports drinks, and even salad dressings can contain a lot of added sugar. The documentary also argues that the food industry has influenced nutrition guidelines and advertising for years, which makes it harder for people to make healthy choices. I do agree with a lot of what the documentary says, especially about how processed foods are everywhere and how unhealthy eating has become normalized. At the same time, I think obesity is more complicated than just blaming sugars alone. Everyone's situation is different. Some people don't have easy access to healthier foods, some work long hours, and others may struggle with stress, emotional eating, medical conditions, or financial problems. So I think it's both a personal and larger systematic issue. That connects to the rise of GLP-1 medications like Ozempic and Wegovy. These medications were originally created to help people with type 2 diabetes, but now they're also being used for weight loss. Basically, they work by helping regulate blood sugar, slow down digestion, and making people feel full longer, which can reduce appetite and cravings. These medications have become extremely popular because a lot of people struggle with losing weight through diet and exercise. Social media has also played a huge role. Celebrities, influencers, and even regular people online constantly talk about how their dramatic weight loss has resulted from these medications. So naturally, more people became interested. There are definitely benefits to these medications. For some patients, they can lead to major weight loss, better blood sugar control, and improved overall health. Some people also feel more confident and physically healthier after losing weight. For patients dealing with obesity-related health conditions, these medications can honestly be life-changing, but there are negatives too. Some people experience side effects like vomiting, nausea, stomach pain, constipation, and fatigue. There are also concerns about long-term use because some patients regain their weight back right after stopping the medication. These medications can be really expensive, and not everyone has insurance to cover them either. I also think there is an important question here. Are these medications actually fixing the root problem? VetUp talks a lot about unhealthy food environments and poor nutrition habits. GLP-1 medications may help control appetite, but they don't completely solve problems like food marketing, lack of nutrition education, or the fact that processed foods are often more cheaper and convenient than healthier foods. And I think society sometimes looks for quick fixes instead of long-term lifestyle changes. That doesn't mean these medications are bad, because for some people they truly help, but I don't think these medications can help alone. Healthy eating habits, exercise, education, and mental health support still matters too. As healthcare professionals, I think it's important to balance empathy with accountability. Patients shouldn't be judged or shamed for their weight because obesity is influenced by many different factors. At the same time, healthcare providers should still encourage healthier habits and educate patients in a supportive way. These topics is also connected directly to hygiene and oral health. Diets high in sugar can increase the risk of cavities, tooth decay, and gum disease. A lot of processed foods, sugary drinks can contribute to this problem as well. GLP-1 medications can also affect oral health. In some cases, some patients experience dry mouth, nausea, or vomiting, which can impact the teeth and gums. Dry mouth can increase cavity risk because saliva helps protect the teeth. Frequent vomiting can also wear down enamel because of acidic exposure. As dental professionals, we can help educate patients about healthier eating habits, reducing sugar intake, staying hydrated, and protecting their oral health. I think patient education is really important because small lifestyle changes can make a big difference over time. Overall, I think Fed Up raises some really important points about nutrition, processed foods, and obesity in America. GLP-1 medications can absolutely help certain people, but they aren't the complete solution to their bigger problem. In the end, improving public health will probably require a mix of better education, healthier lifestyle changes, supportive health care, and realistic lifestyle changes. Thank you.